I first got this job, I was like, working from home, working in an office, this can't be stressful. Wrong. Wrong. This actually is a very stressful job at times. And you are really the person who is not controlling the emotions of these providers, but you are the middle person. And if you start to get worked up, they get more worked up. I'm telling you, the energy is palpable through the phone. I'm not de-escalating patients anymore. I'm really de-escalating doctors. And what I've learned is a lot of doctors have no emotional regulation skills. Basically, my job is I have to triage the patient and follow the pathway that is per our protocol to get the patient the care that they need. It does take some experience. Most of the nurses who work in my department have a background in ER or ICU because it does require critical care experience in the sense that we're triaging these patients. And a lot of them are very complex. So we have to be able to take a call and be like, oh, this sounds like it needs to go to the ICU. Let me page the ICU doctor, or this needs to go to this surgeon. You really have to understand the pathophysiology, the specialties. And so this job specifically that I have does take a little bit of experience in critical care to understand the disease process and to make sure you're not wasting time calling the incorrect providers, or that you aren't missing something and declining a patient who may really need higher level of care. And it's not perfect. There are times where I call a surgeon and they're like, oh no, this wouldn't come to me. You need to call somebody else. And that's okay. That's just part of the job. We're not perfect. We don't know everything. Hello, it's nursing. And it really is collaborative, just like working in the hospital. It's a lot of times of bouncing things off our colleagues. Hey, like, what do you think about this? Similar to when you're working in an emergency room. And now the caveat to that is when you're working remote from home, you are alone. We do have like a Teams messaging system where we are messaging back and forth. I do have I'll put this in kind of quotes, like charge nurse who we can call and, ask questions. But the expectation is if you are going to work from home, you need to be knowledgeable and efficient and understand the process to get the patients where they need to go. That doesn't mean you can't ask questions, but you can't be calling every 5 minutes. Hey, help me, help me, help me. So you have to be able to work independently from home.